I had been away for 12 days and I went back and I walked around, and every single person in every room was on a vent or on a non-rebreather. On a 12-hour shift, we might have 1 or 2 of those patients come through the emergency department, and for it to be every single patient, it was so eerie.
In the first week, the number of patients, male, female, wealthy, poor, there was no one that was being spared from this. And after that, I knew that things were going to be real.
I think I was mostly struck by how sick all the patients were, but also by the fact that they were all by themselves without family there.
And that's heartbreaking to watch, knowing that folks are coming through the door who may not leave our institution despite our best efforts.
These streets are so empty, but the hospital is so full of so many sick people. How have we found ourselves in this situation?
How would you describe how you feel right now?
Honestly, when I go into work these days, I feel like I'm going into battle. I try to make sure to be hydrated, to be rested, to be fed, ready to go, just because once you go in there, you don't really know when you're going to get a chance to do any of those things, honestly.
Even with social distancing and trying to keep people separated, when things like this happen, you really bring communities together, and the hospital has really come together in order to deal with this. And it happens at every level.
So the nurses, the PAs, the nurse practitioners, the janitors that go in and clean the rooms afterwards, they were spending more time with these patients and in the rooms than I was. And so I feared for them.
Just trying to do the best I can to help out. I work in a hospital, so I can't refuse to not do my job. Nurses, number one, like, they more at risk. They put in their life in this. They inspire me as well.
Some of these people didn't sign up for this kind of risk, but everyone is coming into it completely committed, and that's been very inspiring.
This is what I was trained to do. And you learn in school and you learn in safety training that you have to be ready for an event like this. You should never really think that it's actually gonna happen, but when it does, you go right to the training that you had.
I think the staff goes through highs and lows, but the lows are really hard.
A lot of us have difficulty sleeping. A lot of us have nightmares. So it's trying to make sure we pay attention to that part. Seriously though, we all cry all the time now, so. Just happens. It's like spur of the moment. You never know when it's coming.
With my wife being sick and the amount of exposure that I have, our 6-year-old is staying with my in-laws, and I see him when we go on a walk or 2 a day, and we maintain distance. He brings the dog and we go on these long walks, and my son invented shadow hugs, where we stand just so that the streetlights hit us and our shadows.
Sorry, I didn't see that coming. Sorry.
Those are my best 5 minutes of my day.
There's a lot of people who are dying and they just can't have a loved one at bedside with them. And that's hard because you want them there, but you also want to keep their loved ones safe too.
So many people right now are hopeless because, there's no end in sight, and, everybody's watching the news trying to see where this is going to go. But we just keep going. So if it was really hopeless, we wouldn't be trying.
It's inspiring to see all the frontline staff, how they've come together. The clapping every night in New York City at 7 p.m. That's inspiring.
The word that I would use to describe how I'm feeling right now is proud.
I feel brave.
I would say that I'm feeling a little hopeful.
It's hopeful.
I'm tired. But I'm hopeful.
Right now I'm a little emotional, but that's your fault. I feel engaged.
Grateful.
Thankful.
Proud of where I am. I'm proud to be helping in the way that I am, and I really wouldn't want to be anywhere else but here.
I'm proud of the team I work with. I'm proud of our residents. I'm proud of everybody who comes to walk into the doors of this hospital. The old saying, when bad things happen, most people run away. If you're in healthcare, you're running towards the problem, and it makes me want to come to work every day.
That this is why I became an emergency medicine doctor. So to be anywhere else just wouldn't make sense to me.